Some more health news. Serious back problems, particularly involving compression fractures, can be debilitating and certainly excruciating. But now, new surgical techniques are allowing doctors to literally re-expand a crushed vertebrae. ABC 7's health and science reporter Carolyn Johnson explains how.
In all his years as a Navy pilot, Captain Marlon Townsend never had to hit the eject button. But he hit the ground hard a few months ago, bending down to feed his cat.
And this foot slipped out from under me. Boom. I didn't fall backwards. I rotated all the way around because this was holding me up, and I just dropped from about this height to my bottom, about this height to the floor.
The result was a crushed vertebrae in his lower back.
You don't even want me to try to describe it. It's excruciatingly painful.
The injury led him to Dr. Paul Slosar, an orthopedic surgeon at St. Francis Hospital's Spine Center in San Francisco.
And you see that big divot where the fractured bone is down. And I outlined the normal one here right next to it. You can see how tall that looks.
Yes.
And you can see very easily here how this fracture has reduced the height about 70%.
As recently as a decade ago, Dr. Slosar says the injury could have meant months of bed rest or even major surgery.
Many of these patients who had vertebral compression fractures became chronic pain patients. And many of them led, their spines would deform more and more.
The St. Francis team opted for a minimally invasive technique, inserting a hollow needle directly into the damaged vertebrae.
And that allows us to move inside the vertebrae and create a little opening.
The space is then filled with a new kind of bone cement called StabiliT, developed by a company in San Jose. The system uses radio frequency to heat the cement, allowing it to flow evenly through the needle into the bone. As it sets, the cement expands, pushing outward and helping to restore the height of the collapsed vertebrae, as shown in this animation provided by the company.
If you look at the smallest footprint type of surgeries that we can perform as spine surgeons, this is about as minimally invasive as you can get.
Once hardened, the cement is as rigid as the natural bone around it. Captain Townsend said the effect on his pain was almost immediate.
And honestly, as soon as I wake up in the recovery room, the pain is absolutely gone.
Great. Okay, over to the side, no trouble?
Dr. Slosar says the repaired vertebrae function normally without putting pressure on any of the surrounding discs, helping patients get back to their lives. Carolyn Johnson, ABC 7 News.
So promising. There is also a competing technology for treating compression fractures. It uses a balloon to raise the height of the compressed vertebrae rather, before surgeons inject the bone cement. So some real progress in a persistent and horrible problem for
like
people.
Like a miracle for those people, huh?
You know, we all know people who have this problem. It's excruciating.
All right, take a look outside. It's absolutely gorgeous.